Hi, I'm Garvin. Welcome to our telehealth video series. In this video, I will give a brief overview of what you need to know about Bell's palsy. In particular, I will cover what is Bell's palsy, how do you treat it, and how can you better live with Bell's palsy. So we start with what it is. Bell's palsy occurs when the nerve that controls facial muscles on one side of your face becomes swollen or inflamed. As a result of Bell's palsy, your face feels stiff. Half your face appears to droop. Your smile is one-sided and your eye resists closing. Bell's palsy can affect anyone, but rarely affects people under the age of 15 or over the age of 60. For most people, Bell's palsy symptoms improve within a few weeks, with complete recovery in 3 to 6 months. About 10% will experience a recurrence of Bell's palsy sometime on the other side of the face. A small number of people continue to have some Bell's palsy signs and symptoms for life. The signs and symptoms of Bell's palsy come on suddenly and include rapid onset of mild weakness to total paralysis on one side of your face, occurring within hours to days, making it difficult to smile or close your eye on the affected side. Facial droop and difficulty making facial expressions, pain around the jaw or in behind your ear on the affected side, increased sensitivity to sound on the affected side, headache, a decrease in your ability to taste, changes in the amount of tears and saliva you produce, and in rare cases, Bell's palsy can affect the nerves on both sides of your face. So the most common cause of Bell's palsy appears to be the herpes simplex virus, which also causes cold sores and genital herpes. Other viruses that have been linked to Bell's palsy include the virus that causes chickenpox and shingles, herpes zoster virus, the virus that causes mononucleosis, the Epstein-Barr virus, and another virus in the same family, cytomegalovirus. With Bell's palsy, the nerve that controls your facial muscles, which passes through a narrow corridor of bone on its way to your face, becomes inflamed and swollen. Again, usually from the viral infection. Besides facial muscles, the nerve affects tears, saliva, taste, and the small bone in the middle of your ear. Bell's palsy occurs more often in people who are pregnant, especially during the third trimester, or are in the first week after giving birth, if they have diabetes or have an upper respiratory infection such as a flu or a cold. So next, how do you treat Bell's palsy? So first is medication. Study results have been mixed regarding the effectiveness of two types of drugs commonly used to treat Bell's palsy: corticosteroids and antiviral drugs. Corticosteroids such as prednisolone are powerful anti-inflammatory agents. If they can reduce the swelling of the facial nerve, it will fit more comfortably within the bony corridor that surrounds it. Antiviral drugs such as aciclovir or valacyclovir may stop the progression of the infection if a virus is known to have caused it. So next treatment option is physical therapy. So paralyzed muscles can shrink and shorten, causing permanent contractions. A physical therapist can teach you how to massage and exercise your facial muscles to help prevent this from occurring. A final treatment option is surgery. One way to relieve the pressure on the facial nerve is to surgically open the bony passage through which it passes. In some cases, however, plastic surgery may be needed to make your face look and work better. So finally, we look at how do you live with Bell's palsy diagnosis. So home treatment options include protecting the eye you can't close. So using lubricating eye drops during the day and an eye ointment at night will help keep your eye moist. Wearing glasses or goggles during the day and an eye patch at night can protect your eye from getting poked or scratched. Taking over-the-counter painkillers such as aspirin or ibuprofen or paracetamol may ease your pain. Applying moist heat, putting a washcloth soaked in warm water on your face several times a day may help relieve pain. And doing your physical therapy exercises, massaging and exercising your face according to your physical therapist's advice, and help relax your facial muscles. Finally, before I finish, there are a number of products available at Lynch's Pharmacy in Douglas in Cork to assist you in managing Bell's palsy more effectively. We have a range of equipment to get you active and get the heart pumping. So exercise balls, floor mats, weights and various equipment required for exercise bearing or weight bearing exercises. We also have pedometers, skipping ropes, body fat monitors, calorie counting diaries. And there are supplements, alpha lipoic acid, vitamin B6 and vitamin B12 and zinc, which would be recommended to take during Bell's palsy recovery. So that brings this video to an end. Customers of Lynch's Pharmacy can avail of a brand new service, a telehealth clinic. This is where we help you to better understand your condition, and together we create a cohesive management plan which enables you to take an active role in managing Bell's palsy with confidence. So call into us at Lynch's Pharmacy in Douglas in Cork, or call 021 436 6923 to find out more. Thank you for watching. Stay healthy and stay informed.